Colestipol Hcl is used with a proper diet to lower cholesterol in the blood, which can help decrease the risk for strokes and heart attacks. Along with a low cholesterol/low fat diet, exercising, losing weight if overweight, and stopping smoking can also help this medication work better. This medication is a bile acid binding resin, which works by removing bile acid from the body. In people with high cholesterol, this causes the liver to make more bile acid by using cholesterol in the blood, helping to lower cholesterol levels. It is important to consult your doctor for more details on the benefits, daily dosage, and the optimal timing for taking this medication. To take Colestipol Hcl, follow your doctor's instructions and take it by mouth, usually 1 to 2 times a day. If your dose is more than 1 tablet, take the tablets one at a time with plenty of liquid, such as water or juice. Swallow each tablet whole and do not crush, chew, or break them. If you have difficulty swallowing the tablet whole, consult your doctor. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. It may take several weeks before you get the full benefit of this drug. Colestipol may decrease your absorption of other medications, so take your other medications as directed by your doctor, usually at least 1 hour before or 4 to 6 hours after Colestipol. Take this medication regularly at the same times each day to get the most benefit from it, even if you feel well. Most people with high cholesterol do not feel sick. If you experience constipation, stomach/abdominal pain, gas, nausea, or vomiting while taking Colestipol Hcl, consult your doctor or pharmacist. To prevent constipation, make sure to consume enough dietary fiber, drink plenty of water, and stay active. You may also need to take a laxative, so ask your pharmacist which type is best for you. This medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, if you notice difficulty swallowing, chest pain/pressure, severe stomach/abdominal pain, unusual bleeding/bruising, rapid breathing, or confusion, contact your doctor immediately. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching/swelling of the face/tongue/throat, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. As always, if you experience any side effects, contact your doctor for medical advice. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Colestipol, it's important to let your doctor or pharmacist know if you have any allergies, as this medication may contain ingredients that can cause allergic reactions. You should also inform them about any swallowing problems, constipation, hemorrhoids, or kidney disease in your medical history. Colestipol can interfere with the absorption of certain nutrients, so your doctor may recommend taking a multivitamin supplement. If you're planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you're using. Older adults may be more sensitive to the side effects of this medication, especially constipation. If you're pregnant, this medication should only be used if clearly needed, as it may affect the absorption of certain nutrients. And while it's unlikely to pass into breast milk, it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Colestipol Hcl, as they can affect how your medications work and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Colestipol Hcl include blood thinners such as warfarin, mycophenolate, and raloxifene. Always consult with your healthcare provider for the best time to take this medication and the appropriate dosage for your specific condition. If someone has taken too much Colestipol Hcl and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe stomach or abdominal pain. It's important not to share your Colestipol Hcl medication with others. While taking this medication, it's important to have regular lab and/or medical tests to check your blood cholesterol/triglyceride levels and vitamin levels. Make sure to keep all of your medical and lab appointments. If you have any questions or need more details, consult your doctor for guidance. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take the next dose at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing Colestipol Hcl, you'll want to keep it at room temperature, away from light and moisture. Make sure to store it in a place that's not the bathroom, and always keep it out of reach of children and pets. And when the product expires or you no longer need it, be sure to dispose of it properly according to your pharmacist's or local waste disposal company's instructions. Never flush medications down the toilet or pour them into a drain unless directed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.